Thank you very much, Governor, and it is a pleasure to join you today to talk about our surge capacity and our readiness here in the state of California. California's hospitals have been and continue to be ready to deal with the COVID crisis that we have all been working with for the last 4 months. And we continue to be ready to care for all Californians. And that is for a good reason. The governor has been briefing everybody on a daily basis about the numbers. We do have an increase in the number of COVID positive individuals in the state of California. And for us in the healthcare delivery system, that translates into more people who are in need of hospital care and more people who are in need of intensive care as well. So we have seen about a 49% increase in the number of people needing hospital care in just the last 2 weeks, about a 38% increase in those in need of ICU care. So California's hospitals are really doing 3 things right now. It's all about planning and preparing and partnering. First of all, on the planning, hospitals have, on an ongoing basis, an emergency operations plan. That plan and teams that are dedicated within each and every one of those 416 hospitals to being ready and prepared for any kind of emergency. We have learned quite a bit in the last 4 months, so we are adjusting those plans to take into account how we have prepared, how we have to prepare differently as we're seeing numbers begin to climb again. In terms of preparing and being ready really logistically, the governor has just talked about a number of things. Hospitals are being prepared and logistically prepared as well. We are building up our inventory, whether that is of personal protective equipment, masks and gowns and others, attempting to build up our capabilities and our inventory of testing supplies. We are working to be prepared to make certain that we're cross-training staff. So nurses who may typically serve at a bedside in a medical or surgical unit, how can we train them up in case we need them in an intensive care unit? So many things going on right now in terms of being prepared, including looking at every nook and cranny within California's hospitals to see if there is more space we can dedicate to caring for COVID positive individuals. And finally, partnering. The governor just mentioned the important partners we have in our nurses and in our doctors. We cannot do it without those frontline caregivers. That partnership has to be solid, and we continue to work to make that happen. Hospitals are also partnering together so that we can balance the load of COVID positive patients as we're doing right now in Imperial County, also in the Bay Area as we are dealing with outbreaks there in the prison system. If hospitals work as teams, we can move patients and ensure that they are transported to the right place where we've got that additional capacity. We can work as a team. We're partnering with our counties and our local health officials because we've got to be able to do that regionally as well. And of course, our partnership with the state. And that is in terms of the stockpiles of masks and other kinds of equipment that's out there and available and needed as we take a look at being ready for even higher numbers. So we're preparing to surge. We're going to surge differently this time. We have learned a lot in the last 4 months. We know that we have different tools available to care for COVID positive patients. We've got therapeutics like remdesivir and others that are actually shortening the stay of those patients. We are putting fewer of those patients on ventilators. Our doctors, our nurses have learned quite a bit in the last 4 months about how to care for COVID positive patients. And all of that, working as a team, rowing in the same direction, means that we can do that even more efficiently and create even more capacity in the system to care for more COVID positive patients. So the surge is about finding a balance between caring for COVID positive patients and continuing to care for everyone in the state of California. And so the last point, and it's the point you've been hearing, but I really want to thank each and every one of you. The best way that we can expand and have as much capacity as we need to treat COVID positive and patients with COVID-19 disease is to make certain that we're stopping the spread of the infection in the first place. And that is all about masks and social distancing and hand hygiene. Every time you do that in your home, in your neighborhood and in your community, you are helping a nurse, you're helping a doctor, you're helping a hospital, and you're saving a life. So thank you for your continued focus on those practices. Help us expand the capacity that we have to care for those in need. Thank you.